This is a quick video about meniscal tears. Meniscal problems are one of the most common things we deal with in orthopedics, certainly in sports medicine. The meniscus is a pad between the femur or thigh bone and the tibia or shin bone. You have two. One is on the inside here that we call the medial meniscus. The other is the outside over here called the lateral meniscus. And they are C-shaped structures that act as a shock absorber to help cushion between the femur and the tibia. Tears occur commonly with specific twists or compressions on the knee, and the patient can know right away that there's been a meniscus problem. On the other hand, a lot of these occur and the patient doesn't really remember a specific trauma, but they begin to be having knee pain, maybe some swelling, clicking, other symptoms that go along with a meniscus tear. Although not always true, the inside or medial meniscus here, patients with a tear there are pretty specific about having pain on the inside part of the knee. Conversely, on this lateral side, they are pretty specific about having pain here. Those patients that have global pain all over the knee are less likely to have a meniscus problem than those that are pretty specific. It's common to have mechanical type symptoms, clicking, catching, popping that can cause pain. And in addition, many times we see patients with a little bit of swelling in the knee. With these meniscus problems, it becomes harder to do things that you want to do, like ride a bike, run, and be very active. Sometimes having the leg really flexed down, just working on hands and knees, can be painful and give you some limit. On an occasion, the knee can lock, and what can happen is the meniscus can actually come out of place and sit in the middle of the knee, which makes it so that the knee then can't fully straighten. So when we say lock, we're typically talking to the patient about an inability to fully straighten the knee. And when that happens, we obviously have to take care of that situation quicker than normal. Typically with most meniscus tears, there's no urgency to have to go in and surgically treat them. Conservatively, we allow people to maybe back off on their activity some, potentially use some anti-inflammatory medication, ice. Some patients might do an elastic sleeve over the knee to help with a little bit of pressure. But the point being that we don't necessarily have to rush to surgery. Many patients are worried about making the tear worse, and so are very cautious what they do with their knee. And although we don't want people to be unreasonable and maybe go out for a 10-mile run hurting all the time, we do want them to be reasonably active in their day-to-day activity and give their knee some time to see if it responds and symptoms can go away. In evaluating the knee, we obviously take the patient's history to find out what their symptoms are and how this occurred and do a physical exam. And most commonly after this, if we feel we may need to proceed with treatment, it's most common for us to get an MRI of the knee. If patients have persistent symptoms, then we treat this surgically by putting an arthroscope, a microscope inside the knee, looking at everything within the knee, but then trying to focus on the particular part of the meniscus that's damaged. This is one of the most common orthopedic procedures performed. The majority, we take a damaged part of the meniscus out, but occasionally we feel we can get it to heal back in position, and we will actually suture it back in place. If we do perform a repair, we then many times have to limit the patient somewhat on what we can have them do post-op with knee range of motion, and we may even have to protect them with a brace. This is all dependent on the type of repair done for that particular patient. The vast majority where we do not need to do a repair and we trim the damaged part out, we start immediate motion, immediate weight bearing, and the recovery can be actually days to a few weeks and really not interfere with daily activity of the patient that much. Many meniscus tears occur in a knee that already has a little bit of arthritis or some early degeneration in the knee. So although the meniscus can be torn, it's only a part of the overall constellation of issues. And so dealing with a meniscus in that setting certainly may not solve all the pain or limitations that a particular patient may have. Even in a normal knee, removal of that damaged meniscus doesn't guarantee all symptoms go away, although it is a highly successful operation. When we have to remove cartilage, it is true that we lose a little bit of cushion, and the concern is, in the long run, could this lead to increased arthritis? There are many factors involved in the chance of you getting arthritis. How the leg is aligned, say being bow-legged or knock-kneed, genetics, other injury into the knee like ligaments or cartilage, and all of those can play a role. But clearly, when possible, if we have a really good meniscus with good blood supply, we would want to fix it in a younger patient. This is a simple video on meniscus tears and is designed to give you a little bit of insight into what the meniscus is and what a tear is like. We can't answer all the specific questions and go over the risks and complications of treatment, the implications of repair and not in a particular individual, and all of these would need to be things discussed with the surgeon.